Well, hi, Lisa. Thanks for joining us today to talk about Neatly Health and your experience. We can start with telling us a little bit about yourself and your health situation before Neatly.
So about 2 years ago, I was diagnosed with lymphoma. And with my first appointment, I started recording the appointments just on my iPhone and figured that would be a useful way to keep track of a lot of information so that I could later research it. Obviously, it was all new territory for me. Had to learn a lot of new terminology. And of course, I spent a lot of time on the internet after each appointment. So it's useful to have those recordings. Over time, it got to the point where there were so many recordings that I kind of forgot what was being said in prior ones and started to play around with transcription because it was easier to go back and read than actually listen to the recordings. Here we are a couple years later, and you have stood up Neatly, which has taken all the little challenges with recording appointments out of that game, so to speak. Initially, I was, like I said, recording them. Then I played around with transcription, which kind of worked, but didn't work really well 2 years ago. I was doing this all on kind of platforms. And then taking that transcription or whatever I learned from the recordings and going into ChatGPT or Claude and playing around in there. It was just kind of clunky to do all of that in multiple platforms. The creation of Neatly has made that much more seamless and user friendly across the board. It's been a great tool to not only in recent appointments that I've had, but to go use Neatly with the recordings from 2 years ago so that the app has all of my lymphoma history, which has been a great resource.
You are a very unique person in the sense that you're so forward thinking and recording all of these conversations that you've had with your physicians. Do you have any perspective on the type of information that you actually get with your interactions with a doctor compared to what you might get afterwards or retain or what you can access through the doctor's notes that are provided online or directly? I'm curious what your sense is in terms of how valuable is it to actually retain what the doctor said to you in a conversation, even if you have similar information available to you after.
It's been huge. Basically, I don't have to retain it. So I can go back and capture it later, or I have kind of a memory of what was said and I can go back and look at the detail of it. There's less concern about memorizing drugs that they threw into the chat or they mentioned. And of course, spelling these drugs is impossible. So it's easier to just let them say it. With the advancements in AI, it's been capturing those drug names quite well. And so I just don't have to worry about that. I don't have to stop the appointment and say, wait, will you spell that for me? Or wait, will you say that one more time? I have a little bit of hesitancy to ask questions sometimes. I feel like I'm questioning my doctor's authority or knowledge when I'm questioning things. So it takes away some of that intimidation where maybe I wouldn't have asked before because I feel more educated. I think it's also because I'm asking more educated questions, my doctors are having better conversations with me and taking me more seriously. Recently, I went to get another opinion at Northwestern, and both doctors that I saw mentioned, you're not the typical patient. You've clearly done your homework. You know what you're talking about. And, sometimes that's not entirely true, but I'm glad that's what they think. I'm glad I sound like I know what I'm talking about because I think they give me a little bit more consideration when making decisions because they know I'm a well-informed patient.
Quick
Yeah.
follow up on that to Larry's question. So before you had recordings that you were able to transcribe on your own using free tools and whatnot, and then you also had things like MyChart that has your clinic or hospital generated summaries, right? And other resources available to you from Epic, essentially. What's your experience been in terms of that world, right? Of your own recordings and having MyChart versus having Neatly?
Interestingly, this is not a criticism in any way, but sometimes they don't align. And sometimes my after visit summaries don't match the recordings. And I've honestly not really done anything about that. I have not questioned what was documented, but mostly because it kind of wasn't that important. Had it been something really critical, I certainly would have corrected the documentation in my chart or asked to have it corrected. I think it drills down a lot more having the actual transcription rather than just the doctor's viewpoint of the appointment, instead of my viewpoint or both of our viewpoints.
So, and just to be clear, you're talking about the summaries within Epic.
Yeah.
And my
like
chart. Okay.
Right. Like a after visit summary, or, I mean, that's pretty much the only thing that's kind of the doctor's perspective. The other documentation in my chart might be like lab results or something. And I have taken lab results, it's not lab results so much, but like PET scan results, like pathology reports and things, and literally copied and pasted them into Neatly as well prior to Neatly, Claude or ChatGPT, just to see what would come out of it. And it does quite well. And I think that what I find Neatly does better is, or it's just easier, is it Neatly already knows what I'm talking about. There's context to it. It knows some history. It's not just a random question that I'm asking ChatGPT or something. And so I think that's the key difference there.
Yeah, I think so. Kind of related to that, right? So you have this my chart, right? And so you go in there for labs, you go in there for the after visit summary that's generated by your physician. You have Neatly. Have you had an interaction since using Neatly where you feel like there's a specific moment where Neatly's made a real difference to how you navigate healthcare, like whatever aspect of it that you're needing to navigate?
Yeah, I think I've been asking multiple hospitals or multiple providers for something kind of unusual and something kind of risky and not commonly done. I get mixed results, or mixed answers from these different providers. Some are like, no, that would never be done. No, you don't need to worry about that. And I had forgotten that my hematologist said specifically that I need to have my kidney transplant donor and my bone marrow transplant donor be the same person. And when I brought that up with other providers, they thought that was irrelevant or not necessary. And it's been nice to be able to know that kind of I've validated that is in fact what my hematologist said. And I kind of had forgotten. And honestly, I didn't pick it up until I uploaded. That was one of the recordings that I obtained prior to Neatly. And so when I uploaded it to Neatly, it extracted that information and provided it in the summary. And I had completely forgotten or missed it altogether. And so I was able to go to these other providers and make that specific request and kind of just have it validated that is in fact what my hematologist recommended. And then I had another example, but more recently, it gave me the opportunity to just have really specific questions for Northwestern, where they were able to then recommend some things that I wasn't aware of back here in California that I might be able to look into, and hadn't come across that yet. So it neatly kind of extracted that as well and recommended I look into it more, gave me some research paper to look at. And so that is kind of my next avenue where I didn't have any idea I'd be going down that path. And so it really steered me a different direction.
Great to hear.
Yeah. Well, so it's interesting. You just mentioned a research paper and recommended questions, and I don't know if you've tried this yet. I think you have, but I don't want to put words in your mouth. Medical information can be very complicated, right? And there's a first pass sometimes that we've all used Claude and ChatGPT and whatever, where it gives you information. But the great thing about these language models and about having, in your examples with Neatly, all this information in one place is you can ask it to explain it differently or to make it simpler to understand, right? And more specific, can you tell me about this medical paper and how it really specifically applies to me? Did you use any of those techniques? Did you learn those things on your own? You've been very creative with the way you've used this, and I'm curious how you learned how to navigate it, because we weren't helping you at all, and it turns out you've been very skilled at figuring out how to get the information you need.
Yeah, I think sometimes I will ask Andy, I wonder if Neatly will do this. And he always turns me right around and says, why don't you ask Neatly? And so that's kind of where I started to be more creative. And instead of just sort of asking myself and not doing anything about it, I'll simply ask Neatly to, when it provided that paper, for example, I read the paper and tried to make sense of stuff that I haven't studied for 25 years. And am I a candidate for this process? Or do you think I'm a candidate for this process? Neatly kind of went into, you meet the criteria in this respect. You may not meet the criteria in this respect. Here's the questions you should ask the team of doctors that did the study to see if you are a candidate. It didn't necessarily say yes or no, or um, I probably didn't get to all the detail, but it did understand the paper enough and explain it to me enough so that I could then go and ask the appropriate questions. And it seems worth pursuing to me, whereas maybe some other study might have just said, no, you're not a candidate for this. And I have played around with asking Neatly and being, just kind of almost having fun with it. Like, okay, Neatly, I'm dumb. Please explain this a different way. And it will definitely try to make it more scientific or less scientific, or if it can't quite explain it, it'll just help me go find the information. Here are some questions you should ask. Here are the things you need to understand. So it always gives you the next steps.
Yeah, that's great to hear. Did you ever have an aha moment when you were first working with it, where you're like, oh, okay, I like where this is going?
Yeah, I think Neatly at least gave me the term medical memory, because I asked it Neatly developed a bunch of questions for the two doctors I saw at Northwestern. And then that was like several weeks before I was going to need to actually use these questions. And so I said, Neatly, how am I going to get to these questions again? And Neatly just basically explained, just ask me to pull them up again, because I'm your medical memory. And I think that term was kind of an aha moment in a way, because it's basically your own memory of your experience through all your appointments and everything, but you don't have to actually remember it. And it'll store it and organize it for you and bring it back when you need it. So I just need to remember enough that it actually occurred, and so that I could tell Neatly to bring that conversation back up, or bring that appointment back up, or bring that list of recommendations back up or something. And so I've become better at kind of organizing my questions and using keywords so that I can help it recall certain things. So I feel like I'm training Neatly as much as Neatly's training me to communicate with it.
That's kind of the way it's supposed to work, I think. Yeah, that's great. And it sounds like there's quite a difference now in how you handle and prepare for appointments compared to what it was before. And it sounds like the doctors react differently from the way you come in prepared now versus before.
I think so. Yeah. I think I was kind of a rookie at being sick with my first a handful of appointments, but now I've kind of got it down. I think I went through a spell of sort of not caring about my appointments, just because nothing new was coming of it, and same old, same old. Fortunately, nothing new. In my case, no news is good news, but also made me kind of a passenger to my health instead of in charge of it. And I was honestly kind of bored and just done with it. But playing around with Neatly and getting, using the app and uploading all my old recordings and seeing what it would do with them, and has kind of re-energized my interest in getting some better answers lined up, and getting some solutions for the future that I don't necessarily need right now, but will someday. And so it's helping me get ahead of that a little bit.
Yeah, you're hitting on something that I find really interesting, which is I know doctors try to treat all patients the same, but a patient who comes in asking for specific things and driving the conversation, they get treated differently, right? And it sounds like you feel like you have more perspective and clarity on what your path is going forward.
Yeah, I wish I had more clarity, but I feel like I have better understanding of what I need to request of them. Like, instead of just listening, I need to know exactly when they say kind of vague things like, you might end up with this situation, or you might need this kind of treatment, to push a little farther. I usually don't get a specific answer, but they start to explain a little bit more in general, like, well, this is what you're looking at. And if this does happen, this is what it will look like. This is what your life will look like. And so I think it just challenges them to be a little bit more thorough as well with their conversations. I'm sure that doctors have bad days and are bored sometimes with their profession, and I need to snap them out of that, I think. And so if I'm not getting their A game, sometimes I can ask a question that will kind of bring them back to the conversation.
I think we have time. I know that we've been peppering you with a lot of questions. I guess it's an opportunity to flip it a little bit. And like, do you have any questions for us?
Yeah, I was trying to think about that when you mentioned at the beginning. I think I'm always curious to know what's next. I know you have a roadmap and there's a lot of things on it. I guess personally, I hope that this will be a tool that I can use for free or low cost, if that's always going to be an option, and where you guys might think it's going in the next like 6 months or so.
Yeah, I mean, I can start off with some very concrete elements of our roadmap. So one, a big point of focus for us right now. So there's kind of two things that we're focused on. One is what we call caregiver support. And so that's if you're trying to engage other people in your care or you're taking care of someone else. And so we've had quite a few requests from people basically saying, how can I share my stuff with someone else just to keep them up to date or so they can help me along the journey? And so that's definitely one big area that we're focused on right now. The other one is how do we continue to make Neatly work better to get a more comprehensive view of you and your medical records? So being able to take pictures of your medication bottles or a radiology report or a lab report and being able to ingest that data directly. And that way you're either not needing to copy paste it or trying to somehow dictate that back in, right? And that way we can then have a better view of you as a patient overall in your clinical profile, as we call it internally. And then in doing so, we can then start to get ahead of the curve a little bit with things like clinical trial matching or just having a more comprehensive view overall. So I think those are kind of the big two buckets that we're looking at right now.
And I'll just add that you talked about cost. Our goal is for what you're doing right now to be free to patients. Like, this is a tool that we think that this type of functionality should be available to everyone. And so our goal is to keep it that way. One of the ways, or the way we would like to make money on this, is to sell aggregated population data about, how doctors talk to patients and how they present certain drugs and treatments to them. Never having Lisa's information ever released, but having, 1,000 Lisa's informations aggregated and sold to the healthcare industry so that they can get a better perspective about what goes on and where patients come from, why they choose treatments and the like. And if we can do that, then we can keep this free, and that's our goal.
Very good. Yeah, I think you mentioned the caregiver part of it. Keeping my mom in the loop on all this has been kind of exhausting. And I know I shouldn't complain about it, but I do get tired of the 10,000 questions all the time after an appointment. I've been able to ask Neatly to write a summary for my mom, and she really appreciated that. I sent her those summaries, and she's able then to ask me questions about the summaries, which has been a really nice way for us to communicate. It sort of removes some of the aggravation over having to repeat myself. And that's been a really nice feature that was kind of unexpected.
And I assume you just text her a summary from the app. There's that little text button inside the summary.
Yep.
Yeah.
Yeah, the share button. Yes. Yep. That's exactly what
Share.
I did. Yep.
That's great to hear.
And I think it's also made, from a perspective of a user who's not super technologically strong, I think it's made me a better user of AI. Like when you use ChatGPT or Claude or something, you have to be very, very detailed to get good results. And maybe a more typical user is used to Googling things and maybe not even realizing they're using AI when they're Googling things anymore. But because Neatly has your medical memory, so to speak, or all that history, your prompts don't have to be quite as good. They can be a little bit more casual, and it'll still pick up on what you're getting at, which I think has been nice.
Well, thank you, Lisa, so much for sharing your experiences today. We're thrilled that it's working for you, and your story is exactly why we wanted to do this. And I just also want to tell you how brave I think you are, and just thank you for everything.
You're welcome. Thank you for having me here today.
Thanks, Lisa.